Cardiac rehabilitation is something that is so important to patients' outcomes in the end. You know, a lot of people suffer from heart attacks, go into hospital, have all of their massive interventions that are absolutely fabulous in saving the patient's life. But unfortunately, there's something lacking when they're discharged, and a lot of the time that comes down to proper rehabilitation. And given the nature of herbal medicine, we have an amazing opportunity to offer the patient because we're so patient-centred. And for me, using liquid herbal medicines allows us to really focus in on the patient's individual needs and what we can actually achieve for the patient. And that is something that then improves outcomes with cardiac rehabilitation. As we all know, cardiovascular disease is a massive problem in industrialised countries, particularly in Australia, the US, the UK, and it's one of those things, one of those diseases that is largely preventable if we deal with a lot of the risk factors and deal with them early. And it's the unfortunate thing that a lot of the time it's education that is lacking for people, but also it's that ability to have the tools to deal with the risk factors. A lot of conventional medications are designed to intervene once a pathology is really developed. Ideally, we want to intervene before that. We want to be able to treat the risk factors to prevent the pathology really developing. So herbal medicine gives us that opportunity to address risk factors ranging from high blood pressure to problems with lipids in the bloodstream, high levels of cholesterol or imbalances in the types of cholesterol that we call dyslipidemia. Gives us a lot of opportunities to deal with those risk factors at the earliest stage possible. So using herbal medicines, we can directly address those, and ideally, before the patient gets their first major pathology, we can actually intervene. As we know, hypertension is a major risk factor in cardiovascular disease. It's one of the biggest components of atherosclerotic change and influences in a negative way the outcome of patients long term. But it's a fascinating risk factor because it's largely an invention of modern diagnostic methods. It's not something that's been known traditionally. It's not something that's really been treated in traditional herbal medicine. But now we understand the importance of it, so it is something we have to address considerably. And it's something that more and more we understand affects people even at quite early age, from the late 20s onwards. So addressing it as soon as possible is ideal. Herbal medicine has a lot of opportunity to treat hypertension using methods that we just don't have available in any other form of medicine. One of my favourite examples of that is something like olive leaf. Olive leaf is just a nature's miracle, if you like. It's, when you think about the active chemistry of olive leaf, it has 3 major actions on blood pressure that are totally separate to each other, all embedded in one single little leaf that we can then prescribe to our patients. If you chose to prescribe conventional drugs to try and achieve the same kind of outcome, you need 3 different drugs with the associated adverse reactions that are most likely to develop, whereas olive leaf, you know, this little miracle in a leaf, gives us a lot of opportunities to focus on aspects of high blood pressure, including peripheral vascular resistance, to focus on aspects like reducing blood volume through a slight diuretic effect, and it even has a slight ACE inhibiting effect as well. So all in one little leaf. So imagine what's available to us if we combine with a few different herbs. So when we're trying to address hypertension, the first thing that I find really, really essential is identifying what aspect needs addressing in the patient. For some people, it's a really high